Those who support or those who oppose health care reform are fighting to win public support. And to that end, both sides have launched an advertising blitz. So far, supporters of reform are outspending opponents about 2-1. We're continuing to fact-check the arguments in this debate, and tonight, ABC's Kate Snow examines the ads.
When something goes slow enough, it's easy to kill it.
You would think it was a presidential campaign.
Do you trust Washington with your life?
I think Americans deserve better.
They prey on our weaknesses, trying to separate the healthy from the sick.
If all you knew about this debate was what you're seeing in TV ads, you wouldn't have a clue what's really going on.
Washington's latest health reform idea.
The U.S. Chamber of Commerce today launched a multi-million-dollar ad campaign in 21 states criticizing health care reform.
With big tax increases, even on health benefits.
True, the House bill does raise taxes, but only for families making more than $350,000 a year. That claim that your health benefits would be taxed? Not so fast. Senators are considering taxing the most generous benefits, but that's not in any legislation yet. This ad from a conservative seniors advocacy group plays on the fears of seniors.
For seniors, this will mean long waits for care, cuts to MRIs, CAT scans, and other vital tests.
Fact is, the House bill does include cuts to Medicare payments to providers to try to promote efficiencies.
Anytime somebody talks about finding some savings in Medicare costs or holding down the very rapid growth in costs, they get accused of cutting benefits. But it's really misleading. You can't really show that there are going to be cuts in benefits.
We're a second-generation family business.
Supporting the president, a small business coalition and a teachers union started running this ad today.
Bill in Congress that will lower health care costs for families and businesses. That's what we need now.
But it's unclear whether the savings for families will happen. Reformers hope that a government insurance plan competing with private plans leads to lower premiums for all. But that's just a goal. And will businesses have lower costs? Depends on their payroll. In the House bill, if it's more than $250,000, the company has to help employees pay for health insurance.
If you mandate businesses to buy insurance for employees who don't have it now, that's a big expense.
Health insurance reform, what's in it for you?
Many Democratic ads make sweeping promises, like this one from the DNC.
President Obama's plan will end unfair insurance practices, like denying coverage for a pre-existing condition.
True, the House bill does say an insurance plan cannot deny coverage because of a pre-existing condition, but they have 5 years to comply. A lot of these ads are frightening, and on both sides, groups are making many claims that can't be proven or disproven for a couple of reasons. Congress is still working on language of the bill, as Jake said. In fact, a key Senate committee hasn't even weighed in yet. And some claims, Charlie, rely on so many assumptions that it's impossible to know whether they will come true or not.